Welcome everyone back to TrimTab Space Camp. We're here today with Daniel Schmachtenberger. TrimTab Space Camp, as you all know, is this opportunity for all of us to think big and to explore the world around us and understand the wider context within which we all live. We're looking at different sense-making frameworks. We've learned about ecology and Gaian systems and rapid prototyping in this course, and leave it to Daniel to go meta and teach us about sense-making itself. Daniel is a good friend and student of Buckminster Fuller's, started reading him before he could read, actually. His parents would read him Synergetics as bedtime stories. And he's kind of a protege of Fuller's amongst others, and I look to you, Daniel, as a source of wisdom and confidant and advisor for the Buckminster Fuller Institute. And just such an honor to have you here today. Thank you so much for making the time amidst this wild global crisis. And thank you for all the response work that you've been doing for this. I really appreciate it.
Very happy to be here. I remember when you and I first talked about this type of course happening for Bucky Fuller Institute, where people could learn good sense-making tools and be able to apply them. So I'm just really delighted this is happening now. I think it's a great service.
Mm-hmm. Yeah, came at a great time. So we're going to explore sense-making today. Could you kick us off with just telling us some of the kind of core principles of sense-making and how we can maybe apply that to this global crisis?
It's a funny way to start a conversation, like core principles of sense-making. And the reason we use a term like sense-making is how do we make sense of the world and reality that we live in, which is kind of a common vernacular for epistemology. How do we go about knowing things, and what is the basis for appropriate belief in something? And this is obviously not only the basis of the philosophy of science, which is how do we go about knowing objective things about the objective world, but all of philosophy, the epistemics of whatever it is that we are claiming is true about anything, what is our basis of our truth claim? And so someone can easily study this field for their whole life and scratch the surface of all the good thinking that has been done. And our basis for right action in the world to be effective at anything is going to be our basis of understanding the nature of the world and the nature of being able to consider what the effect of a particular action are going to be. So overview of sense-making 101, like what I hope we can do is share a few principles that are a valuable start to just add something to the picture that can also inspire people if they're interested in terms of where they can go further. And maybe be able to show the application of those to things that are currently trending questions with regard to this, COVID-19 global crisis and the attendant set of world issues that are happening. So I'm going to assume also that the basic philosophy of science and kind of basic Karl Popper sensibilities and kind of understanding of logical fallacies and critical thinking is at least somewhat familiar. Mm-hmm. And if that's not true, then take a look at those terms that I said and at least go read the Wikipedia page on them. Logical fallacies, critical thinking, philosophy of science, Popper, those would be starting places. Those are by no means an adequate frame for sense making, but they are common, valuable frames, good starting places. So I'm going to kind of assume those and build on there. If I use terms that you think would be unfamiliar, please stop me and we'll unpack them. So the difference between science and epistemology writ large, just to kind of say it, is science is the method of science is an epistemology. It is a process of knowing about the objective world we find ourselves in, meaning objects that can be measured, and then where we can do repetition on measurement and then be able to abstract patterns from those. But measurable things are third-person things, right? We can all measure something independently, get the same type of measurement, and then be able to, so measurable and replicable. Science exists within the domain of the measurable and the replicable. If you imagine we have a 2x2 matrix of things that are measurable and unmeasurable, there are a lot of things that are real and are unmeasurable, like an emotion. You can measure a neural correlate and you can't get anywhere close to actually measuring all the things that are happening. We don't even begin to understand how to do that. We can do very rough, QEEG, whatever kind of stuff. But you can't measure emotion. It's a first person thing. You measure third person things. You can't measure the inside of a black hole. You can mathematically infer stuff. You can't measure things that are below the scale of measurability. There's a lot of things that are real that are unmeasurable, which means they're formally outside of the domain of science, but that doesn't mean that that any claim about them is equally true. Right? There are still methods of sense making that are going to be more reliable than others. And then replicable. There are certain things that are measurable but not replicable because it's not a control kind of situation where we can replicate it. So formally, the thing that we call science, the processes of science, exist within one of four quadrants, in which the real includes all of those. So when we talk about sense making, we're including all of it. And so science is necessary, but not sufficient. And it ends up becoming actually bad epistemology when you collapse the real to the objective, right? Because then subjective is not real if you make real and objective synonymous. And subjective is also real, but it's not measurable, and you can't do repeatability on the non-measurable things, right? And intersubjective things are also not subjective, right? That's actually a whole different quadrant of things. And even some things that are objective are not properly measurable, or where there's causation, but there's no way to assess necessary and sufficient causation in a formal way. There's nexus causation, like in complexity, so we have to apply different kinds of principles. So, and this is when you hear people talk about the problems of reductionism, right? Trying to reduce all of the real to the objective, trying to reduce complex situations to a subset of the variables. And that can be very useful. Reductionism is super useful, but it also has limits. And so it would be bad sense making to use reductionism without understanding its limits. It would also be bad sense making to reject reductionism in a kind of overly sweeping sense. Now, when we're looking at social situations, and trying to make sense of politics and economics and whatever, there's a lot of things where we won't really be able to measure what's going on. There's information that are company secrets and trademarks and patents that are intentionally kept classified or obscured by governments. There's stuff that we haven't figured out yet, and yet there's still consequence to what's happening now, and we want to figure some stuff out that we don't have the ability to do the appropriate formal science on, even if it was in the domain of science. And why are certain agents doing the things they are has to do with intent, which is outside of measurability. We can only measure the effects of it and then try to infer it. So sense making of what's actually going on, and how do we know, and how do we get enough confidence to inform right action? And when do we not have enough confidence to inform right action? And how do we have a clear basis for what our confidence margin is, and what our confidence margin for right action based on the consequentiality of the situation? What should it be? This is like kind of how you start to think about what the topics that sense making is addressing are. Well, I'll actually speak about confidence for a moment. One of the things, we'll actually come one step back. The essence, if you wanted to say there was an essence, the essence of good sense making is earnestness in the desire to understand what's happening. And an earnestness that both wants to know what is rather than wants to believe something in particular. And an earnestness that is willing to do the work that it takes to actually come to understand that, rather than jump to premature beliefs because that is comforting or allows you to be part of an in-group or seem knowledgeable or whatever else.
So kind of brings us back to a couple of things we've learned, both in ecology and in rapid prototyping, just like the importance of humility and curiosity, of not being attached, being maybe committed to something, but not attached to what it may be, in the case of rapid prototyping. And then in the case of ecology, just being kind of humble and curious about the world around you and seeing it in more of that kind of dynamic flow. So
right.
Good stuff in there.
So curiosity and humility and earnestness, these words all kind of go together here, right? And so it was a very nice definition of science Eddington gave, that science is the earnest endeavor to put into order the facts of experience. So what are the facts of experience? How do we know? And like, what am I experiencing? What are others experiencing? Can I trust that they're recording the facts of their experience, in an adequate way? And how do we put into order some kind of sensibility of that? So if earnestness and like depth of curiosity is the kind of essence of science and epistemology in general, then bias would be the enemy of it. And bias can come from lots of sources. It can come from wanting to be part of an in-group that believes a thing, where it's costly not to believe that thing because you'll be excommunicated from your religion or seen as a conspiracy theorist or a status quoer or whatever it is that your particular in-group would happen to see as bad. That's going to create a source of bias. If you want to be seen as in the know because you have particular kind of ego identifications, or you want the previous thing that you did your PhD on and got famous for to keep being right, even though new stuff is coming out that might suggest otherwise, right? Ego stuff can obviously be a source of, I want this to seem true, whether it actually is true or not. Financial interest is probably the main thing that messes science up because somebody's funding the science. And typically that funding is coming from some existing pool of money that made the money by doing something that makes money, that is going to fund stuff that makes it more money. So it is not interested in things that are not going to make money. It's interested in things that probably will. Mm-hmm. And that means that either
self-dealing, right?
Self-dealing. And, even if, so it's totally possible that someone is doing science in a way where they're actually doing authentically bad science because of financial interest. They are hiding data and whatever. But it's also possible that someone does quote unquote good science, but that where the preponderance of evidence is misleading because they're only looking at the parts of the whole picture that have profitability. So if I look at pharmaceuticals, for instance, and the research into healthcare, doctors currently, because of the regulatory landscape in the US, aren't allowed to prescribe something if it is not FDA approved to prescribe that thing. FDA approval process requires phase 3 clinical trials that cost most of $1 billion. Who's going to pay for that? Well, a pharma company can pay for it if they can make that money back and make enough money back. So to be able to make that much money, you have to look at a patented thing, because otherwise I put in the research money, I put in the $1 billion, and then I'm selling something competing on the margins with other people that can make the thing at the same cost and didn't have the upfront $1 billion. So I've got to be able to recoup that money by having a much higher price that nobody can undercut me. So we can only patent synthetic molecules for the most part, not things that are in plants or nutrients or whatever. So those things are just never going to get the same kind of research funding. So then you'll have a preponderance of evidence that says these things are more effective than these things, but it was because they were, and it's not even necessarily that each study was bad, but it's that it's not well distributed. The distribution of what's being studied and the distribution of reality don't match, right? And so that's another place where bias is going to be able to affect and mess up sense making. So because of that, I would say that we have less real science in the world than I would like to see, and we have a lot more of the R&D arm of capitalism. And this becomes one of the things that for individuals trying to make sense of the world, even if you're reading scientific papers, trying to make sense of all of the papers in a space together, trying to make sense of the biases of the authors, trying to make sense of the bias associated with the funding, looking at the methodology itself. These are all things that are worth factoring when trying to make sense of something. I was going to say something about confidence and certainty. So one of the major sources of bias is emotional biases. We talk about cognitive bias a lot in science, and that there are like all of these logical fallacies or cognitive bias, but a lot of them come from emotional or identity or existential or social kind of needs, where believing something actually feels like it is meeting some need or way for me to live. So I have a basis other than just knowing what's true to want to believe something in particular. So a lot of people who are seeking security conflate that the way to get security is certainty about the nature of reality. And so they will seek excessive levels of certainty with an insufficient process for gaining it, because they actually have a certainty bias because they're unsafe if they don't have that, right? Or something like that. That's an example. It's not exhaustive. So a fundamentalist religion would be a classic example where I am utterly certain about the absolute nature of reality, the name of God, what happens after you die, and all this kind of stuff. And it's like, really? That whole idea only came about not that many thousands of years ago. And before that, the people were just as certain about other shit, and that particular God name had never even been proposed. And but there is you can see in the face of the uncertainty and the unknown of death, if someone is not friends with the unknown, if they're not friends with uncertainty, and then where they can't see, they can project scariness into that space, then they want to be certain. And so they want to have faith, even if it's not epistemically grounded. This is actually very interesting. People's fear of dark. And it's like, why is it that I'm more afraid of the exact same environment when I just can't see it than when I could, when it's the same environment with the same agents in it? And I'm not even somewhere that has nocturnal animals or whatever. Like, what? Maybe sometimes that's warranted, but a lot of times that's not warranted, right? So where does that come from? Well, if I can see, I know there's nothing bad. If I can't, then my mind starts projecting stuff in there. People have this of dark water, of deep water, where they can't see, and death, right? So, and unknown in general. So it's very easy to have a bias towards certainty. And now that can be expressed through people who are, quote unquote, using scientific ideas just as much as it can religious ones. So there are people who are quoting science, but what you can see is they don't think of science as a process of knowing. They think of it as a body of knowledge, and that there are these things called facts, and that they're totally well known, and that those people who understand it are right, and other people are not just wrong but stupid. You'll notice that the bias in the nature of their communication is to always have pretty high certainty, even if it's just very high certainty that other people who are presenting something that doesn't look like the science they want are certainly wrong. And so you're like, oh, they've got that same bias going, and they're plugging in a science set of languages rather than a religious set. Now, on the same side, people can have a bias towards uncertainty, but these are still biases. So this is classically what happened with postmodernism, right? And postmodernism said science actually claimed some shit that it shouldn't have claimed. It actually had the wrong epistemology, and it had bias going. And this was specifically in the social sciences, where Victorian white men were looking at the racial superiority of men or the white race, or looking for monogamous pair bonding in nature because of Victorian ideals when they did zoology or whatever. And you're like, oh, this is actually a pretty significant confirmation bias messing up the thing that we're calling science, but being accepted as scientific ideals. So then there became this idea that science was just the same as all the other. And I'm giving an extreme example, so forgive me. Obviously, Foucault and Derrida were not stupid, and they didn't say this, but a lot of the people who don't read them all that well make this kind of generalization. That there is no truth. There is no absolute truth. There is no way of knowing what is more true, and that anyone who claims to have a more access to or a valid process of truth is just some form of imperialism. And that because science was in spreading industrialism at the same time that empires were using it to suppress the lower class and kill indigenous people and ruin the environment, that those are somehow conflated, and that then all perspectives on reality are equally valid, and we need to listen to them all equally, and there are no valid truth claims. This is gibberish, right? Because recognizing that social science is subject to bias in a particular way, where you have extraordinarily high complexity and a high basis for bias, is very different than, say, physical chemistry, that does not conform to, that's very, very simple, and doesn't have the same kind of bias being admitted. So, and also then the fact that some people did social science badly doesn't mean that it can't be done more earnestly and better. So it does it mean that we always want to be looking at bias? Yes, in science. Mm-hmm. That we shouldn't consider science unbiased? Yes. But does it mean that all truth claims are equally valid? No.
Mm-hmm. The social science thing is the acronym WEIRD populations: white, educated, industrialized, rich, and democratic. Mm-hmm. There's a narrative, of rightfully so, narrative that a lot of the social sciences have been studied on weird populations, those, people who are kind of readily available in industrialized college settings. So that's one thing that kind of people have been pointing to more and more. And I think it's really important right now for us to kind of just point out, like, where are we exhibiting different, racist or colonialist perspectives, but yeah, also not throwing out the baby with the bathwater. And I think that differentiation you made of science being a methodology rather than kind of like the set of truth that's like already known, is really critical. As we're putting out the design science, decade as Buckminster Fuller Institute, like getting people to kind of blend in the design thinking with all that we can, glean in understanding the world through science. It's really helpful to have that differentiation.
So when you think about the social sciences here and what we said in the beginning about the measurable and the repeatable, I can measure a chemical pretty well. I can do different types of measurements. I can use microscopy and spectrometry and whatever, and then contrast that. And a lot of other people independently can. And the physical properties, the chemical properties of it will conform pretty well. I can't measure what someone feels, or really the nature and nuance and complexity of what they think, or the sense of their relationships or their motives are, or whole populations or how those change. I can observe certain things about the output behaviorally, but then I have to infer a whole lot. And so the total complexity of social science is way more complex, way more variables, and there's way more that I can't directly measure, right? It's not third person, it's first person and second person. And so that was absolutely an overstepping of the idea of what would fit into the rigorous domain of science and what the nature of the truth claims could be. So while it's true, yes, it's true that there's a lot of stuff that we have excessive certainty of that we shouldn't. It's also true that we can overcompensate and pretend that we don't have the certainty on some things that we should, and that there are not better epistemic processes, even if none are perfect, for coming to confidence in something. So this question of what is, for a particular topic in that domain, what is the appropriate epistemic process to come to relative confidence? Why do we think that it's that as opposed to something else? And what are the axioms that we're drawing upon, and how do those reify themselves? And what is an appropriate level of confidence, and what is an appropriate process to come to that level of confidence to inform certain kinds of action? Right? Those are all kind of important questions. Now, I'm getting into this a little bit more formally than I thought we would, and to get into the more probably daily practical stuff, we'll get there in a moment, and it might go beyond the course of what we can do in this short time. But I wanted to say this thing about certainty and uncertainty is a mature relationship to certainty. There's a rabbi friend of mine that actually first told me this, so it came from that background. But a mature relationship to certainty is that we're comfortable having certainty where it is warranted, knowing that it's never 100%, but there might be 95 or 99% based on the total amount of data that we have relative to the total situation. And we're also comfortable in uncertainty, because if, like the postmodernists, we're scared of certainty or uncomfortable with it, or like on the other side, we're uncomfortable with uncertainty, both of those are biases that won't actually have us just think clearly. So we want to be friends with uncertainty, knowing that the unknown and actually the unknowable is a very large infinity. And then we also want to endeavor earnestly to gain the certainties that inform appropriate right action, responsible right action, where we can actually take responsibility to affect the things that we care about in the world. So I don't want to be attached to that what I think is right, but I do want to be attached to understanding reality as clearly as I can, so that I can act as effectively in service of the good. So if I am working towards helping hunger and I work really diligently and earnestly and make no progress and more people are getting hungry, I want to be able to say that I'm failing, right? Like it's very important. And then I want to be able to say I should do something different rather than continue doing that thing, because I actually am result oriented here, not just process oriented. I actually care about the people getting fed or the coronavirus getting solved. And so I want to make sure that that my understanding of what's going on, that informs what I think would be effective, that informs the things that I try, that then I retest to see are they working, is actually working. Okay, that's all very basic, but it's still worth kind of framing up. I think we can get into what are good tools of epistemics, but probably I think the place where maybe the most value can be harvested the fastest is what are the most common places where people mess up. Like how do you're probably sense making badly if.
Mm-hmm. Yeah, I think that would be helpful, especially in this moment as we are all trying to make sense of this crisis and what it means. And, you know, a lot of people in this course looking to like, what is the opening that's being provided by all of this, right? And wanting to step into that without being tone deaf too, I think is a theme that a lot of us are looking into. And part of that is just making sense of what's happening, so that we're all making the tragedy worse.
Okay. So with regard to that, you know, the tragedy worse, is there an opening to make it better? The better and worse are not what we'd normally think of as epistemic questions. They're ethical or existential, right? Like what is good and what is bad. But that's absolutely relevant. So there's bias there, and let's speak to it. So there is a bias that I notice really damaging people's sense making when it comes to coronavirus, and it also damages their sense making regarding climate change and existential risk and kind of risk writ large. Mm-hmm. I'm going to oversimplify on purpose to start the topic, and knowing that I am oversimplifying and we could get into a much richer discussion of it. It's easy to have a bias that we could kind of flatly call a positivity bias that doesn't want things to be really bad. Like just doesn't want to believe that, think that, can't be with it, doesn't want to feel it. And so wherever people are claiming that shit is bad, they're likely to think that it's probably alarmists. Those are probably people that are catastrophizing. There's probably some good innovation that's going to come along that will solve it. Like before even researching it, there is a immediate bias either to be kind of almost aesthetically repulsed by it or to move away, or to assume it's probably wrong or probably won't be the whole story. Whereas when evidence comes along of things are getting better or it's not that bad, there's an instant resonance before doing a similar level of sense making. That's like, oh, see, things are getting better. And there's a kind of positivity bias that I think is actually worth having, and a kind that isn't worth having. The kind that biases our assessment of what is terrible. The kind that is committed to understanding what is very, very clearly, including all of the negativities that are current and the negativities that could be, the risks, so that we are empowered to help make things better. And the positivity bias is that I want my thought, word, and deed to all be working towards making things better, which requires understanding what is. That kind of positivity bias is great. It's not messing up our sense making. It's applying our sense making in an empowered and constructive way. But I'm not going to be good at making things better if I'm not seeing what is clearly. So there is when you think of the term spiritual bypass, but it can be a psychological bypass or a kind of epistemic bypass of any kind. It's any spiritual idea or philosophic idea or bias that wants us to not be with some pain, right? So in the kind of spiritual bypass, whether it's like, well, they incarnated to have those lessons, or their soul chose this, or there will be some silver lining in it, or God works in mysterious ways. It's some way of being able to say, I don't have to feel bad about this thing that otherwise I would feel really bad about, because I don't feel like I can hold that or be with it. Which is kind of like a pseudo sociopathy, right? One of the things about sociopaths is that others can be hurting and they don't feel bad, which is why they can hurt others. And so any idea that makes us able to not feel bad in the presence of others feeling bad is taking beliefs that are moving us in the direction of a sociopathy-like set of behaviors. So when I'm seeing people who are gasping for air and dying in that way, and their family members can't even be with them on their deathbed because they would get sick, I'm upset about it, right? And that it's unnecessary and that we could have prevented that. I'm super fucking sad for them.
Yeah.
And I'm super fucking mad at the people that are making choices that they, for poor reasons, that could have prevented it or done a better job. And I wouldn't want to feel any other way. Like there would be something wrong with me if I didn't feel those feelings. It would mean that I had to be fractured inside. Mm-hmm. I'm speaking to this because I see this rampantly with people latching on to, oh, there's this new drug, it looks like it's going to work, before there's really good sense making that we know enough about the drug, because they really want something that's going to work. Oh, there's this great new diagnostic test. Oh, there's this one epidemiologist that said it's really not that bad. Oh, look, there's this thing that shows empty hospitals. Maybe it's really not that bad. And they'll latch onto that shit before really studying it, but reject the other, which means that they won't be part of making things better. So this is a very common bias. And of course, it goes without saying the exact opposite bias is also common, which is a catastrophism bias, which is whenever there is something that looks like it could be that something isn't that bad, or that there might be a solution, someone tends to think that it is probably going to fail. And when they see anything that looks like a possible risk, they assume it's probably going to happen. And they emotionally, and it's like, okay, let's say we look at the situation today where the response to COVID has started to damage the food supply.
Yeah.
That's a huge deal, because messing up the food supply and wars and riots over food supply and insufficiencies of food supply and whatever could kill a lot more people than the virus. And that's a place where our response to the virus might be much worse than the virus itself. And this is a big deal. So is there a big deal when you start messing up the food supply? Yes. Does that mean that the food supply is already so messed up that it's inexorable that 2 billion people are going to starve? No, we can still totally do stuff about it. Yeah. But there are some people who I've talked with over the last couple of days who've called me freaking out saying, did you see, like, there are locusts in Northern Africa and the Middle East and crops rotting in India? We're losing the food supply. Everybody's going to starve. Well, it's true. There are locusts in Northern Africa and the Middle East, and it's a big fucking deal. And crops are rotting in India. It's not true that 2 billion people are going to starve. It is true that they could. But what's happening is that typically we want to do worst case scenario forecasting so we can prevent it. Because if you don't know that it could happen, then you don't see what the escalation pathways are, then you can't prevent it. But then if we prevent it, the people with the positivity bias will say, see, you were just catastrophists. For doing that, nothing bad really ever happens. All that bad ever happened. It would have happened had we not done these things. It only didn't happen because we did the worst case scenario planning and saw what it took to prevent it. So I want to do worst case scenario, but know that it's a scenario. It's not that it's already happened. And then I want to see how to prevent it. So I want the positivity to be oriented towards action, not towards sense making. So does this make sense on positivity, negativity bias, and how they mess up our sense making?
Mm-hmm, definitely.
And especially where there are high consequence, high pain topics.
Mm-hmm. Yeah. Yeah. And it seems like there's just kind of this through line of kind of like the ego getting in the way of, like, people want to have the bias towards certainty, but a bias towards certainty kind of shows up in this way too, intermingled with the positivity and the catastrophic bias of just people, especially right now, because everything's so up in the air, people just want to have some grounding, and so I've seen in myself and in others the just bias towards, okay, I want to make sense of this, I want to know, what's happening, in what order, with what time frame. And I think something that we've seen, again, in a through line through a lot of what we're learning is just like, the world is dynamic. It's always shifting. Change is the only constant. And so how can we kind of be more comfortable with not knowing exactly what's going to happen, but be in that state of still widening our view, still having, like, facing that with like a deeper hunger for knowing as much as we can.
Yes, and the deeper hunger that is not a hunger that jumps to false conclusions because we want them, but it does the hard work that it takes to actually endeavor towards. So, you know, I really want to know what you were just saying, right? I really want to know what's going to happen, what could happen, what the right order of operation should be, how we should tend to think. I'm working on knowing that stuff. But I don't think that I can scroll my Facebook feed and read for several hours and have a good sense of those things. It's kind of like I want to be buff and I don't want to work out that hard. Like it's just not going to work, right? So there is an input-output equation that has to happen. And like being buff or being able to play the piano, like being able to make sense of a topic takes the work that it takes. And so now this brings us to the next bias. Mm-hmm. Well, I can't do that much work because I'm not an expert in virology or in epidemiology or in immunology or a industrial sanitation engineer or in diagnostic medicine or in the privacy considerations for contact tracing or in macroeconomics or in domestic politics security or in the nature of what's happening with geopolitical positioning or in supply chains of food. How the fuck could I possibly know all that? But there are authorities that know this. So I'm going to defer to the authorities. I'm going to cognitively offload that complexity. Now, there is a bias in terms of how people relate to authority that's important. And it similarly, I'm oversimplifying, has a bias on two directions, both of which are bias, which means not clear, which is there are people that tend to think that most of the people who are in the primary authorized positions are probably trustworthy, which would be a silly thing to think. And other people who assume that they're always untrustworthy and corrupt, which is also a silly thing to think. And those are very kind of sweeping generalizations that keep us from actually doing sense making because we're not looking at what are they actually saying, what is the track record of where they've been right and wrong on this topic so far and historically, and where is there a divergence or a convergence of opinions of people, and am I biasing towards some of them because of political association or because of positivity or negativity bias or things like that. So can I find virologists that are saying, oh, this is not mutating in a way that's going to have a worse strain? Yes. Can I find other ones that are saying, oh, the next strain is probably going to be many times worse? Yes. Who are experts. So how do I possibly make sense of this if I'm not a PhD virologist and there are eminent ones who disagree, pretty intensively? And on every topic, we can say something like that, right? Well, you actually can. This is the nice thing, is that you have the benefit of being able to look at where experts are converging, where they're also diverging, and what the basis of the divergence is. And possibly having less bias than them because you didn't get a Nobel Prize saying this thing where you have an ego invested in defending this particular thing, and you don't have research grants that need to believe in this thing, and you haven't had all of your attention in this one part of the picture where this virologist is looking at this one's looking at this one's looking at this. You can have an epistemic flexibility that can look at those and also look at what the nature of the bias they might be running is and try to get some parallax across those. And so, but on this one about authoritarian versus anti-authoritarian bias, this is one of the most fucking common things that I see that messes up everyone's sense making. So there is a meme complex you can see all over the Facebook, say, which is, I'm tired of fucking tinfoil hat wearing conspiracy theorists talking nonsense and armchair epidemiologists. This is the place for experts. If John Hopkins and the CDC say it, that's what's true. Nobody else should be weighing in on this. We should listen to the things that they say and empower the experts on this. And vaccines work, and I don't want to hear anything else about it. And whatever the authorities think are appropriate measures are the things that we should do, right? And that everything else is gruesomely irresponsible. And then, of course, we also hear this other memeplex that all of the authorities were completely corrupt for various vested interest purposes, and we can't believe any of them, and everything that they're telling you is false, and et cetera. And I think both of these are pretty close to equally gibberish.
Yeah. Hanlon's razor is a philosophical razor that's like, don't attribute to malice what can be adequately attributed to ignorance.
Yeah.
I think so many of us, yeah. our trust has been broken in however many ways, and then we like think, they are out to get us. And I think it can be a waste of precious human brilliance, ways of thinking.
Okay, so there's very strong bias in both directions when it comes to conspiracies. Mm-hmm. Conspiracy. Are there times where some people conspire, meaning share information with each other that they don't publicly share to advance particular agendas, that if publicly shared wouldn't work? All the time. Like, that is the nature of the world. Now, and so like for every Watergate and Enron, there's a million of those that are not publicly caught, but like that's what Machiavelli told everyone to do. That's what Sun Tzu and the 36 stratagems, that's what military theory and political theory is all about, right? How do you conspire with some in-group to advance a particular agenda against out-groups and anyone who'd get in the way of it? And when you look at Genghis Khan and Napoleon and Alexander the Great, when you look at the barbarism of the 12th century, we're genetically those people still. We have the same brains and the same hormones. Like, we're not that different. We have just, like, we're more civil in some ways. We also just hide it better. So, our lovely previous Democrat president, we bombed a lot of civilians to death in the Middle East with the largest military the world's ever known. Yeah. But it wasn't here, right? And factory farms are as brutal as anything has ever been. And they're mass scale, and most people contribute to it financially. They're paying other people to do their dirty wet works for them and then feeling civilized. And so we should not wrongly assume that we are more civilized than we are, and that there is not a shit ton of malice, or even just having accepted that that's the nature of the world and, rationalized ladder climbing in politics. We also shouldn't assume that every time that there's something that doesn't make sense, that it is highly coordinated malice, because coordination is actually fairly hard, and very often it is just incompetence and or the nature of the incentive systems. So assuming any of those things means you aren't thinking. If you're assuming it's probably ignorance, you aren't thinking and you aren't paying attention. You're bringing your own bias into it. If you're assuming that the authorities are probably well-intentioned or they're probably not, you are not thinking. And so this is what I want people to notice in their bias, is what things tend to bother them. There are a lot of people where if it comes from an authoritative claim, they're just bothered off the bat. Or if it sounds conspiratorial, they're bothered off the bat. This is not good sense making. Or there's something that's a rule of thumb, like you just mentioned, that they take as if it was almost absolute. Like they apply it kind of feverishly. Right. So what I'm wanting is for people, it's like Ecclesiastes, a time to kill and a time to heal and to sow and to reap. And there's a time for every epistemic tool. Like there's a place where they all apply. And so what you want to do is go into a situation and say, maybe malice is happening here. Maybe simply incentives in politics are, maybe incompetences. Maybe it's actually being handled brilliantly, and my overall assessment of why it's not being handled brilliantly is wrong. I don't know. And I don't know just because it's an authority, or just because it's a wealthy person, or a whatever, or just because it is part of Trump, or, the people who are against Trump. If Trump happens to like hydroxychloroquine, no one should automatically like hydroxychloroquine more or less because Trump happened to say it, because the fact that he happened to say it has nothing to fucking do with whether it works or not. And obviously Trump didn't just pull hydroxychloroquine out of thin air. Some doctors and scientists told him some data about that. Now, so we should actually look at the data on that very closely and carefully. During the Obama administration and all the administrations since Nixon, Washington, D.C. primarily ran what they called the benign China hypothesis. China's not trying to become a world empire and, free trade with them and blah, blah, blah. And, we started hearing Trump, China, 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 and people being upset that he was wanting to do certain kinds of tariffs or trade war type things, or whatever, but being concerned about what the Chinese geopolitical agendas were. He was right. He was actually right. The benign China hypothesis was gibberish. If you read the 100-Year War and you look at the activities of Chinese Communist Party, there's absolutely global agendas. It would be silly to think otherwise. Now, he wasn't right out of nowhere. He was right because Bannon and others happened to give him insight there. And it happened to resonate with that as just kind of a deal maker kind of guy. When he sat across from them, he probably had the sense of like, oh, fuck, it feels like these guys are playing some pretty serious game that some go game that I don't feel well set up for. Now, he's been wrong about a gazillion things. And so again, wanting to over norm that he's wrong and stupid and evil about everything or right and the savior on everything is not thinking. Now, of course, it's fine. If I'm trying to sense make, there might be some people who are right often enough that I look to them as sources of higher signal, lower noise up front, but I still check. And there might be other people that even though they've been right a couple times, I assume it's probably low signal enough that I generally don't check. Mm-hmm. But I can't generalize on that in consequential areas. So hydroxychloroquine, I'm going to use this because this is a very good example of where sense making is tricky, where it's consequential. So hydroxychloroquine is a anti-malarial primarily, but it also has antiviral properties, has been used as an antiviral, and is used in rheumatology heavily for rheumatic conditions. It's a drug that's been used for many decades, very heavily. Since Vietnam, the United States military has put most US soldiers on it before they deploy to areas that have malaria as a malarial prophylaxis. So before they go to Africa.
I took it every week for the first 4 years of my life because I lived in Ivory Coast.
Yeah, exactly. And so we have a pretty enormous amount of data on the long-term effects and the safety and the whatever of hydroxychloroquine. Is it a totally benign drug? No, it's not vitamin C. It can absolutely affect hearts, this thing called the QT interval. It's contraindicated with some meds and some conditions. But do we at least understand the contraindications and the general safety profile well, especially as a old generic drug that has been around forever and been in combination with all the other drugs and has a generally pretty good safety profile relative to advanced COVID infections? Yes. Do we have randomized control trials that show that it's effective? Placebo double-blind, placebo-controlled, multi-location type of thing? No. Those are fucking slow. Those take a long time to do. Now, those are awesome. Like randomized control trials are totally a good sense-making tool, an epistemic tool. But there are a bunch of people who have been taught that it is the only tool that exists to make sense of pharmacology, which is utter nonsense. That means that those people are not actually making good sense of the world or thinking. They've been drilled in this kind of over-norming on one tool because it happens to be a lovely tool when we can do it. And it also happens to be the one that the FDA wants. And so it also happens to be the one that you better take if you want a maximum security position to have your malpractice not get you in trouble. Mm-hmm. So this is another source of bias on it, right? What is the maximally defensible position is also a major thing. Okay. By the time the randomized control trials are done, heaps of people will be dead and ICUs will be overwhelmed and case fatality rate will have spiked precipitously. So should we give people drugs that might be more dangerous and not effective just based on pendulum dowsing? No. But are there ways of making sense of something to enough degree to affect some kind of action? Yes. So with regard to hydroxychloroquine, I'll use this as an example. There were randomized control trials for it in SARS-CoV-1, right? That's meaningful. It's a different virus. This is a novel virus, but there's a lot of similarities in mechanisms. There were randomized control trials for it in other viruses, including other coronaviruses. There have been in vitro trials that are very effective on this one, on SARS-CoV-2. And there are a lot of non-randomized control trials, but open label trials. One's in China, one's in South Korea, one's in France, the one in New York, but then heaps of doctors that are using it that are not nothing, right? They're not placebo controlled, but they're not nothing. Now, there are some things that just placebos don't really affect, right? Placebos don't do a good job of healing broken bones. And so we don't need placebo controls for things that don't really produce placebo effects. And so placebos don't kill viruses. Now, do placebos modulate your immune system to some degree? Sure, right? But is there an amount of effectiveness that placebos have on viral conditions statistically, so you can remove that statistical artifact and then be able to still look at, is there effect beyond the statistical artifact? So that's like a way of saying, hey, we can actually kind of make sense of this here, factoring placebo considerations, even if we're not doing the placebo-controlled trial. So we brought a group of doctors together, a group of MDs, to work on doing a literature review of hydroxychloroquine, and by itself and in conjunction with zinc and azithromycin and doxycycline and other things like that. And we looked at the mechanistic trials, the in vitro trials, the animal trials, the current open label trials, previous ones, and we were looking at preponderance of data and looking at relative benefit to risk in different populations. That's actually trying to do sense making with all of the available data, factoring the consequence of action and inaction. Now, I don't get malpractice lawsuits for inaction in the same way I get them for action. So that ends up being a source of bias and a CYA, cover your ass kind of way, that is different than just trying to sense make, how do I save the most lives? And so I know doctors, many of them who I've spoke with in the last few days, who gave themselves prescriptions of hydroxychloroquine for themselves and their family and said, this is absolutely what I would do with myself and my family based on all the literature. But I'm not allowed to prescribe it at my hospital because the hospital said we would be fired for prescribing it because for outpatient treatment because of those concerns. That hospital policy, I believe, is gruesomely negligent in life-saving. Now, are we suggesting that people drink fishbowl cleaner? Obviously not. Are we suggesting that people prescribe shit to themselves? No. That you don't look at heart conditions and comorbidities? No, of course not. What we're saying is, should prescribing physicians who've taken a Hippocratic oath and who are scientifically literate people be given emergency authorization to be able to prescribe as they see fit based on the current literature and preponderance of data for life-saving purposes? Yeah, I think that's a good emergency authorization. Where they're not worried about getting fired or malpractice things, so that they can actually be focused on doing the right thing here. Now, again, with regard to hydroxychloroquine, there's pretty good evidence that in late stage infection, it doesn't help very much. But there are very few antivirals that help in late stage infection in the entire corpus of medicine. And the general rule of thumb with infection as a whole is treat early rather than late, because once it gets bad, it's much, much harder. But especially with viruses, is that only in the very beginning do you have meaningful chance. So a lot of people know if you get shingles or if you get herpes, acyclovir can help if you get to it within 24 hours. At most 48 hours. After that, will do almost nothing. In that time, it does a lot. If you're in late stage AIDS, the antiviral cocktail doesn't help that much. If you're in very early stage, it will prevent disease progression. So if you do a randomized control trial for hydroxychloroquine, or even the open label trials, or FDA provisional emergency approval for late stage as an antiviral, when pretty much no antivirals work late stage, and then you assume what that means about the drug writ large and factoring for early stage, that would just be silly. That would be going against the preponderance of knowledge we have about viral mechanisms and antivirals writ large.
Mm-hmm. Yeah.
So the randomized control trial should be for early stage.
Right. Which is kind of akin to like how we've been testing people. We've only been predominantly have been testing the very sick rather than random sampling. And so we don't really have a good idea of what the denominator is.
Correct. So we do need background random testing for epidemiological forecasting and being able to think about herd immunity and inoculating with less virulent forms of the virus and other things like that. But staying on this one for a moment. So one, should we wait for randomized control trials to be able to make sense of something? No, we should look at the preponderance of all of the data, the risk and the reward, think about different populations of risk sensitivity and comorbidities and whatever differently, and be able to actually apply all of the sense making we have to the scenario, and know that the sense making we would do if we had all the time in the world is different than the sense making we would do when there's consequence to inaction. Which is why I said we have to have the right relationship to certainty and uncertainty and the basis to come to it, factoring the consequentiality of action and inaction. Now, would we like to do randomized control trials to get more knowledge? Of course. Should we be doing them late stage only? well, if we want, let's say I wanted to, and I'm not ascribing malice where it is very likely ignorance, but if I wanted to do an information warfare tactic to prove that Trump was wrong and an idiot, or to make a generic drug like hydroxychloroquine that nobody can make much money on seem ineffective so some patented drug can make a lot of money or whatever. If I wanted to do that, I would set up a late stage trial that showed that it wasn't effective and then overgeneralize those results across the board. And I would also set up a late stage trial where the placebo is vitamin C, which one of the major studies is doing right now, where vitamin C is widely known to be an effective antiviral. And then I get plausible deniability that I'm doing good science because it comes from a prestigious university, when what I'm really doing is info warfare to advance an agenda. So now we start to get into, I struggled through watching this David Icke thing the other day. It was very painful. There was extraordinarily little signal in it. Not none, but very, very little conspiratorial stuff. That said, so Hong Kong had almost nobody die because of good response. And South Korea didn't respond quite as quickly, but they responded well, and still very few deaths. Okay, well, they're littler places, islands, whatever. Well, Germany's not an island, it's not a little place, and their CFR is extremely low. Czech Republic, extremely low. Fucking Vietnam, poor relative country, doing great. Well, some of those Asian ones had SARS, so they were prepared. Czech Republic didn't. Germany didn't. Those are both landlocked. They aren't islands. Those are, democracies, not dictatorships. Could we just not have responded better? Well, we allowed 430,000 people to fly from China since the thing happened to the United States because border closing is xenophobic. No, it's not. We're closing the border to viruses that happen to be on people from wherever the fuck they came from. Close the border to them coming from a European country if that's where they're coming from. So this is now a place, similarly, where if somebody jumps to the problem is xenophobia or racism, they're not sense-making again. We should absolutely fucking shut borders during pandemics where viral transmission is like physically transmitted. You should shut borders between counties within states where there's very highly different distributions of it within the counties to be able to prevent excessive spread. Just like we're stopping the transmission between people and people even within the same city, right? So is it possible that all of the profound getting everything wrong that we have done, the WHO until a few weeks ago telling people not to wear masks and PPE and whatever, that's all just stupidity and incompetence? Well, that would be impressive. It would be impressive. Is it possible that there are some agendas where if things get worse, they do better? Well, if the EU, that's already under a lot of tension, gets more tension because some countries get fucked and other countries that could help them aren't helping them because they only have enough to help themselves, it kind of breaks the EU apart so that the EU can't bring in the Eastern European countries because Russia wants the Baltic states. Would Russia have the goal to do information warfare kinds of tactics to get the Baltic states back? I don't have to say they are doing this to say everything in the precedent of unrestricted warfare and the history of how these things happen says that they would, of course, have that orientation. Is the way that China would be trying to do the Belt and Road Initiative take advantage of the fact that they're the only supplier of PPE and on the other side of this, and the groups will sign the bottom line on things that have fine print that they wouldn't have otherwise if they're going to die of the plague. And, and similarly, if there are groups that want increased surveillance capacity. So this way, should we trust the authorities? Carte blanche? No, that would be silly. Should we assume that they're all corrupt and controlled by reptilians? No, that would be silly. Should we actually try to do sense-making on each specific thing itself, rather than do this overgeneralized thing that unfortunately we can't do in this particular world of cognitive offloading? Yes, that's what we have to do. So with hydroxychloroquine, we can see, okay, late stage versus early stage. Is this really a placebo or is this not a placebo? Randomized control trials are desirable. Are they the only thing? Mechanistic studies, other viruses, what can you tell from another virus to a novel virus? What degree of certainty would be needed based on the consequentiality? These are all examples, and there's like a dozen more I haven't got into, of epistemics you would want to think through to know how to make sense of this. And that you should
favorite ways? Like there's Bayesian decision theory, like there's different, you know, ways to kind of make sense of things with probability. And yeah, do you have favorite tools that you like to use?
I'm upset at the idea of favorite tools. Each of them, it's like I'm going to build a house with a screwdriver. Screwdrivers are awesome.
Mm-hmm. Well, tools that you come back to often.
All of them, and for the things they're good at. So network theory and graph theory are the best things for the thing that they do, and probability and statistics and different statistical tools, mathematics in the domain that it's for, computer modeling, agent-based modeling, machine deep learning on large data sets, first principles thinking in the place where first principles thinking applies, Bayesian analytics where that applies, crowdsourcing versus expert sourcing. When do we use induction and deduction and abduction? Favorite tool intellectually is as silly as favorite tool to try and fix a car or build a house.
Mm-hmm.
Yeah, I like wrenches to fix a car. Awesome. They suck as screwdrivers.
Yeah.
And they suck for welding.
Mm-hmm.
And so if someone actually wants to be able to fix a car, you got to have a lot of tools, know how to use them and know which one to use for which situation. And if someone wants to make sense of the world, same thing. And if that seems like too much, then you should just accept the idea you probably won't understand the nature of the reality you live in and be able to make good choices.
Yeah.
So,
well, within that, it kind of like it brings up people's biases of like wanting certainty and wanting, both positivity and certainty come up in that. Just like, oh, can't you just explain it to me and can it all just be okay? It's been taught over and over again as like an okay response to the world.
Well, this is the psychology of a child that wants a parent to be able to depend upon.
Yeah.
And it's actually interesting. I don't want to over norm here. I don't want to do bad sense making over norm a topic that is super complex, but I will draw a parallel that has at least some truth value. The way people related to their parents as kids often reflects itself somewhat in the bias they have towards authorities later. Their parents and teachers and whatever other authorities in childhood. So the people that did better in school and did better with their parents and kind of did well with the standard model, more often than the other crew will tend to think that the standard model is well and think that the current authorities are probably trustworthy and good. And the people that didn't do well at those things and didn't have trustworthy authorities are more likely to have that generalized sense, right? That's not an absolute. It can come from lots of other things, later life events, but those are interesting things to look at. And it's also interesting where it's like, I want someone to just reassure me that everything will be okay. How old is the psychology having that thought? I don't know what's going on and I feel scared. How old is that? Okay, so now we need to do therapy for inner child trauma stuff that is going to hijack our adult brain being able to make sense of the world, and that will make us susceptible to other people being able to influence us more than they should.
Yeah. Yeah.
This
I think
is where dangerous gurus and dangerous authorities and whatever start to come in too, is they can prey upon that.
Mm-hmm. Yeah. And I think one of the root causes of so many of our interdependent crises right now is that kind of avoidance of that inner work, avoidance of it being even okay to talk about those things, it seems like there's a trend towards, being okay with therapy or coaching as kind of like a therapy-like tool that people are becoming more, it's less stigmatized than it once was.
Well, as people realize that their effective choice making requires effective understanding about both the nature of the world and what the effect of a particular choice or injunction is going to be, then wanting to sense make clearly becomes a very high goal. And once they realize that a lot of the bad sense making comes from psychological predispositions, biases that come from those places, then psychological work actually becomes part of sense making. So as much as I might want to learn math or statistics or Bayesian analysis, I might also want to be able to do bias assessment and be able to see where those biases arise from and clear them.
Mm-hmm. Yeah. So this moment that we're in is an opening for a healing at a lot of different levels. And one of those is I'm finding as people are in stressed situations, some of their kind of like unaddressed trauma is arising. And I think similarly, kind of like our unaddressed root causes of, you know, what's creating the ecological crisis and climate change and everything. Yeah, there's an opening right now for us to see, right? Like the true meaning of apocalypse is an unveiling of a greater truth that was unapparent before that moment happened. So yeah, curious to hear what you think of kind of all of that in sense making and in this moment.
I'm going to share something that I have to share a dialectic of things for it to make sense. Mm-hmm. So where people notice that there is a psychological process that seems more like a child than an adult psychological process. I want to be reassured. I want to be comforted. I don't know what's going on. I want to know that an authority is taking care of it or can tell me what's true. Anything that they do from there will not help. If they're trying to act on the world, if they're sharing information or whatever. So the only thing they can do from there is actually respond to address their own psychology until they come to a more empowered place. And then from a more empowered place, try to sense make the world and then act from clear sense making. Don't act from those places. So I really want to see people showing up in a adult way. But the dialectic with that is you can't just snap your fingers and get there because you want to. There's work that it takes if there are unresolved child trauma type things that keep hijacking you into that state, pretending that that's not the case and saying, oh yes, I feel very calm and centered and I'm speaking like an adult and I'm freaking out inside, whatever. Like then you're just schisming yourself. And so I want to see people showing up as an adult. And that means I want to see them seeing where they aren't and doing what it takes to actually get there rather than pretend. And where they aren't there, I don't want them to have shame about it, but I also don't want them acting on the world from that place. I want them acting on themselves. And then I want them acting on the world when they're in the right place to act on the world. I want us supporting each other in this. If you see somebody sharing information and trying to act on the world from a place that doesn't seem actually clear, that might be propagating problems, then lovingly try to support them to recenter. Neither add to it nor attack them, because that's not going to help, right? Just try to lovingly help them recenter and be open to when others do that with you. In fact, ask for it. Seeking the counsel of people who you consider wise counsel is a sign of wisdom itself. Now, with regard to traumas coming up to heal right now, yes. And this is another thing. So I want people to show up as adults, and that takes whatever it takes, right? So if people are at home and they have extra free time, maybe this is the time they can be doing Skype therapy sessions, and they can be reading the things and doing the meditation and doing the journaling that they've wanted to do. That'd be great. It's either solitary confinement or an ashram, right? Like it can be this great mental health crisis where we get a huge amount of benzo addictions that just ruin everything for a long time, or a emergence into people going deeper into their own wholeness together and with each other. Now we want to work on which of those it is for ourselves and with our communities and with the world as best we can. The same with the educational crisis. This can be the generation of kids that all got no education for some time and had upset parents traumatizing the fuck out of them in a small place, or where we actually reinvent schooling in a much better way in education because we need to. So in all these ways, the same with healthcare, the same with the food security system, the same with our risk prevention system, the same with macroeconomics, it can either get much worse or we can use it as catalyst to make things much better. To be able to do the larger macro things, we have to be in the right place to be capacitated to do that. So we work on that first and then the other. And it's somewhat, ongoingly back and forth as needed. In addition to, I would like people to show up as adults where it is possible. being able to show up in a way that is calm and clear and grounded and not biasing towards seeing things as better or worse than they are, but very clearly, and then biasing towards how to make things better effectively. The people who can do that are the people who will lead the solutions and other people will look to. But you can't pretend. You've got to do what it takes to actually have that happen. And this image of that coal pressurizes into diamonds by pressure, by intensive pressure, right? Or the steel becomes hard through the temperature of the forging process and the banging on it, right? So as there's increased pressure, we can either have it fracture us or turn the coal into diamond, where we become clearer and more crystalline and precise. And to have that as a frame, that as the pressure gets more, I actually go slower, clearer, more grounded, just even as an intention can be helpful.
Yeah, that's really beautiful. Yeah, I forget his name, I forget how to pronounce his last name. He says that times are urgent, slow down. Yeah, it's really important and counterintuitive, and I think, yeah, just overall kind of this appetite for bias and really understanding it is a powerful outcome of this time, as we're all trying to ground in the healthiest way possible.
U.S. Special Forces has this statement, and there's a lot of versions of this perennially, but slow is smooth and smooth is fast. And it's not saying go slow when urgent action is needed. It's saying go fast, but mistakes aren't fast. Mistakes end up being super, super slow. Doing like you're trying to clean the kitchen so fast before guests come and you break glasses, and now you got to fucking take the time to clean it up, and it's way slower than had you moved a little bit slower. So you don't want to break shit, right? You don't want to spread misinformation. You don't want to act on misinformation. So you got to go slow enough to go smooth, where each step is actually a right step and gets to build on right steps, which is actually the very fastest thing you can possibly do. So I'm actually encouraging people to go fast, but actually fast, which means clear, smooth, right?
Yeah. Yeah. Wonderful. We're approaching the end of our time here, I feel. We covered a lot of principles and biases, and just a lot of insight. Is there anything else you would offer? One thing we're asking people is, are there any vocabulary terms that people can kind of insert into their daily or weekly use that would enable them to kind of upgrade their ability to make sense of the world? Are there certain things that you...
Unfortunately, though this is not absolutely the case, the community of practice that in general looks at critical thinking and logical fallacies, and they're the ones that look at bias the most, or very, very frequently in terms of cognitive bias, that whole field, in my opinion, admits a certain bias, which is kind of funny, which is that it is biasing towards analysis over synthesis. So it wants to make sure that it's not having any wrong ideas, and it rejects wrong ideas. But it's not necessarily making sure that the very partial reductionist ideas are being put together in good overarching frameworks, which is the synthesis side. So there is a need for synthetic thought and creative thought, as well as very analytic thought. And so the tools of critical thinking generally help you with the analytic thought more. And so those are necessary, but they're not sufficient. And there are places where there are rules of thumb that are not true. They're rules of thumb. So like the Occam's razor, right? Sometimes the thing that is true actually is more complicated than, the hypothesis than something else. So it's just a general kind of...
Razor, just for those who don't know, is like the simplest solution to something with the less variables is more likely to be true.
Yeah. And we might say that statistically that is often the case, but it also even depends upon the scenario. Like the simple economic models are always really wrong. And the simple biological models are always really wrong because the causation is actually complex. So it really depends on the domain. So in terms of terms, I think people just going and looking up epistemology and reading the Wikipedia page or the Oxford philosophy page and just kind of having a basic sense is good. Looking up, and then if you want to, do the Wikipedia rabbit hole thing. So if it mentions Bayesian analysis, take a little trip down there and maybe go watch a couple YouTube videos on Bayesian analysis and on network theory, on graph theory, on statistics, on learning basics things about statistics, on, as you're hearing the terms epidemiology and virology and immunology so much, maybe just read the Wikipedia page to start. Like, do I know what a virus is? Do I actually know what RNA is? What's the difference between RNA and DNA? I'm hearing PCR and serological and immunological. Do I know what the words mean? How about I just look up the words that I'm hearing, especially before I use them?
Yeah.
That, and I don't have to read a textbook. Let's read a Wikipedia page to at least have a beginning sense, which will actually help humble you because you'll realize that there was much more that you didn't even know that you didn't know about. And then you'll probably, as you know more, actually be more humble in your presentation than as you knew less and just repeated a word. So, okay, in terms of words, I would suggest every word that you're hearing that seems important that you're tempted to say again, look it up first.
Yeah. Awesome. Yeah, and kind of we ask every guest lecturer to come up with an activity. I feel like that could be a good one, is starting with epistemology, go down a rabbit hole and kind of see where you go and see what you learn. Any other kind of guideposts along the way as people are going down that journey that they should consider in terms of doing good sense making?
Not just starting with the epistemology page, but starting with anything on COVID you're reading or looking at. Make a list of all the terms that you don't know what they mean fully. And go read about them and then follow those rabbit holes. Super valuable. And just a super simple thing. We are creating the information ecology for each other, the epistemic commons for each other. And just like it's not good to throw trash on the ground and pollute because it's shared space and the effects, it's not good to put trash information out that pollutes the information ecology. So before you share something, you remember there was this early Greek that held his thumb up to the moon, closed one eye and said, at arm's length, my thumb exactly blocks out the moon. Therefore, the moon is the size of my thumb. And my palm can block out the sun. Therefore, the sun must be the size of my palm. And I don't know if that's a true story. It's a story that is told in philosophy sometimes. And if you didn't know that depth perception was a thing that affected size, it's a rational argument, right? Where the axiom is that distance doesn't affect relative perception of size, right? It's not understanding the nature of a visual cone. It's a rational argument that's gibberish. It's very easy to have rational arguments that are gibberish because they have wrong axioms or are missing something. It's entirely possible that you read something that makes sense to you because there's a rational argument and it makes sense. Everywhere that the virus has been bad, 5G was recently installed. And everywhere there's 5G, the virus is bad. Oh, and 5G just got pushed through. Oh, shit. Well, go fact check that first. Just look at a map of all the places that 5G is, and then look at a map of the places that the virus is, and see if the claim made is true before you share it, because it's not in that particular case. And so just because something sounds compelling and it seems maybe plausible upon first blush doesn't mean that it's true. But if you put it out, even if you say, what do you guys think of this? Because you didn't want to do the hard work of making sense of it, lots of other people who don't want to do the hard work of making sense of it will be compelled the way that you were, and it starts to affect background thought, and you're actually polluting the information ecology. You're throwing styrofoam, your intellectual styrofoam, into the ocean, right? And so just don't do that. And at least do enough research to see that if something is probably not grounded. And then if you don't know how to go further, then do an adequate preface. I looked into this. Here's what I could find. Here's what I couldn't find. I'm really trying to figure this out. Does anyone have good data on such and such? And then tag the people that you think are probably the people who might be able to figure it out.
Right. Start smaller instead of polluting a whole wider landscape. Yeah. Yeah, I think that makes a lot of sense. And just like, I think people, yeah, going to like primary source, you know, just having an appetite for doing our own research. I think so many people have become accustomed to just getting information from other people who've already done the synthesis. And kind of going back to a couple points ago, you were saying there's a lot of kind of analysis oriented tools and not as many synthesis tools or rules of thumb or yeah, work in that realm. How can people kind of balance that out for themselves?
So this thing that is often attributed and quoted to Einstein talking about imagination being as important or more important than intellect and creativity and those types of thinking or intuition, right? So there was this process that Einstein had where he would be working on the math on the chalkboard or on the paper until he hit a diminishing return and he just wasn't making progress. And then he would take a break and he'd go puff his pipe and look at the clouds and kind of zone out, or play his violin, kind of zone out. Mm-hmm. And then at a certain point in the zoning out, an idea would pop. And then he'd go back with that idea to the whiteboard and work on it. So now I'm going to say a metaphor for what's happening neurologically that we don't know if is actually how neurology works, and so I'm specifying that this is not a absolute mechanistic statement, it's a metaphor. So that there is this kind of left hemispheric, more serial, more analytic process. And then there is a more right hemispheric, more parallel, more synthetic process. And the corpus callosum has a largely inhibitory or shunting process between those, and that the analytic process actually has to shut off for a little while for the synthetic process. So the analytic is this axioms, these data, these logical transforms, this, therefore this, syllogistically, right? And the other one is a pattern analysis of look for everything like this, and then aha, that seems to come out of nowhere, what we might think of as intuition, but it didn't come out of nowhere. It's just that process doesn't happen consciously in the same way because it's actually beyond the bit bandwidth of the conscious mind. And that then can give a new insight, but we don't take it as absolute truth. We then have to plug it back into the other process and see how it works. But then once you hit diminishing return there, go back to this one. And I think it was Wigner, might have been Teller, but I think it was Wigner, who about the physicist, the great physicist who developed modern physics, said, we all knew that in terms of raw horsepower, von Neumann was the smartest. Like he could just figure shit out. He could do the math faster than any of us. It was obvious. But for all of his cleverness, Einstein still was the one with the deepest insights. And some reason for that. That wasn't just straight clock speed. It was something else, right? So I would say there is the study, read, fact check, and then also go let yourself have that in mind. Don't distract onto the laundry list or whatever, and then meditate, look at the clouds, zone out, and then see what ideas come and journal those down and then go back, right? Let yourself kind of have both of those processes. And then find the facts as best you can, and then also step back and consciously try to put them together. What kind of overarching picture or narratives or whatever might make sense, but be careful because it might not be a simple narrative. It might be lots of overlapping ones, right? But try to see, would this overarching kind of frame make sense of lots of these? And then say, well, if this narrative was true, what else would be true? And go look to see, is that there or not? What would falsify or verify this narrative or this hypothesis or kind of overarching structural frame? So yeah, those are some things.
Excellent. That's really helpful. What other offerings or ways can people continue to engage with you?
think you shared these. There were these couple videos we did with Rebel Wisdom. They called them the War on Sense Making. It was basically, we're sharing tools of sense making. There we were more sharing tools of propaganda that are commonly used in the media landscape that mess up your sense making, to be able to recognize them so you won't be wrongly affected by them. The intention of those videos was to kind of inoculate people against bad sense making. Those are worth checking out. And then if you want, follow me on Facebook. I don't post public stuff very often, but if I do, I post it there. And podcasts and other stuff. Some of it historically is on civilizationemerging.com, but it's not very updated. Facebook's probably the best place. I find that the earnestness and the curiosity comes from something that you could think of as a spiritual impulse. There is like actually a reverence for reality that wants to understand it. There is a respect for there's a respect for the integrity of reality and a reverence that wants to. And it's almost like if you have a lover and you really want to love them well, you want to know their childhood stories and what they love and their favorite color flower and their favorite songs and whatever, so that you can actually love them well. And it doesn't mean that you'll ever fully know them. You shouldn't ever think that, but that you want to know them better as an expression of the love that's there. And so, and that's not the only thing you want. You don't just want to know them. You also want to have union with them. You also want to serve them, right? Well, the same is true with reality writ large, where you want to seek to understand it. Not that you will ever understand it completely, but the desire to understand more as a kind of cognitive or intellectual closeness or intimacy with reality. It's a sign of a certain respect and reverence and love. And there's something just profoundly beautiful in that. And it's also, and that's where it's motivated by what you just call pure desire to know or pure learning. But where it's motivated by the desire to make a difference in the world, I would like these people not to be dying. I would like to have a solution that doesn't create an authoritarian state because I care about freedoms. That then also is, I want to understand reality enough to be effective, motivated by my love for people, for nature, for reality, and my desire to serve. So the basis of where the energy to do the work comes from is actually love. And the more you deepen your love and care, the more energy you will have to do the work that it takes to have that love and care be active and manifest in serving that which is loved and cared about.
That's beautiful. Thank you. Yeah, I've been talking with a couple people lately of like, what is the contagion of love, that we can kind of match this moment with, as so many are feeling so much fear. And I love, the idea that love can beget reverence, can beget, more and more understanding and curiosity. And it's kind of an antidote to kind of like the fear and shutdown that a lot of people are in right now. It's like a love and the curiosity and the invitational tone of this all is a really lovely antibody to the moment.
There is a little thing I'd like to offer here. It's something a good philosopher friend of mine shared with me that was very profound, is fear is not the opposite of love. Fear is a reaction to love. It is sourced in it. I can only be afraid of something being harmed that I don't want to have be harmed, that I care about. And so when people are totally apathetic, ready to commit suicide, don't feel fear around dying, don't feel fear around hurting other people, whatever, because there is no love or care that is binding them still. And let's say I don't feel any fear over something being destroyed I don't care about. I'm like, fuck it, let it burn down. So the fear is a response to something I love and care about, where I'm thinking about it getting harmed in the future. If I'm afraid of going crazy, it's because I actually love life and my own ability to be sane and to connect and contribute and to take care of my family and to experience whatever it is, right? Like there's actually a value, a reverence on that. Now, the fear might be a unconscious response. I'm not consciously saying I would like to get afraid now. So it's an unconscious response, and it might be a disempowered or disempowering response, but it still derives its energy from the depth of what is cared about. So I can do a conscious and empowering response instead, where I say, oh, I care about this thing. So instead of focusing on automatically, unconsciously, what the bad outcome is going to be and feeling like I can't do anything, so I just get afraid, what is the good outcome I would like and what can I do about it? So I get empowered in that. So I move the fearful to careful, full of care, right? And act from there. Anger also comes from love. Sadness also does. The apathy would just be like, fuck it. I'm not angry. I'm not. And so they might all be unconscious. I'm not choosing to feel that. They might all be disempowering or empowering, but you can find conscious and empowering where the anger becomes more like passion and the sadness becomes more like depth of appreciation and gratitude, and fear becomes more like carefulness and proactivity. But any of those emotions, don't think of them as bad. Think of them as signals of something that is cared about. And then trace it back to what is it that I actually love and care about? And then what is it that I want to have happen? And how can I actually be empowered towards it?
Mm-hmm. Beautiful. Yeah, I had a realization a couple of months ago of, instead of washing away fear, I was sitting on the side of a river, seeing it as a stepping stone, and the other side of the river being bravery, and seeing it as, yeah, the logical response. But I love it interwoven with love. Yeah, and that fearful, careful play on words is very evocative. Thank you so much for your time and for all of this wisdom. Yeah, really looking forward to seeing the conversation that it incites in our TrimTab trainees. And yeah, thank you also for all of the work that you're doing in this moment. Really appreciate you.
Thank you for making this series and for having me here. And I'm very excited to see what comes from the people going through all of these and how their sense making and solution capacities increase and what they can do with that.
Mm-hmm. You're here. All right. Thank you.